Coming up, we'll be on location at the Center for Plastic Surgery in Chevy Chase, Maryland, discussing the latest advances in plastic surgery and how they can help you achieve the beautiful look and the shape that you desire with one of this area's top doctors, Dr. Frank Albino. Welcome, Dr. Albino. It's a pleasure to have you on the Top Doctors interviews today.
Thank you so much. This is an honor, and I really appreciate your time coming in today.
Oh, absolutely. We have a lot to talk about. I wanted to kind of touch on what you offer here at your practice. You offer breast reconstructive and cosmetic procedures. You offer body contouring, facial rejuvenation, and others. Can you tell us a little bit about your vision for the practice and what patients can expect when they come here?
Absolutely. So at the Center for Plastic Surgery, we have 4 board-certified plastic surgeons. So that sets a tone that we are very serious, dedicated, passionate about performing both reconstructive and cosmetic surgery, but we're also experienced, talented and experienced surgeons. At the same time, we have a number of nurse injectors, estheticians, and so we are really a one-stop shop for high-quality, tailored cosmetic and reconstructive surgical and non-surgical procedures. So for me, when I think about the patient's experience at the Center for Plastic Surgery, it's certainly not cookie cutter. It is here 100% tailored to whatever your goals are. And that's beyond just, I want to look good, I want to feel good. It's also taken into consideration, what is your lifestyle? What sort of downtime can you have? And many patients today are looking into non-surgical options. So I think in summary, we have it all here at the Center for Plastic Surgery, and I think that's what's really exciting about it.
Well, that's great. I think that's a wonderful approach. You really take the time with each patient to understand their needs because, as you said, not everyone's the same. They all have unique appearances and different needs, and to understand that, to educate the patients and work with them as a partnership is a fantastic approach.
Absolutely.
There's been so many new procedures that are really cutting edge that can help patients achieve the look or appearance they're trying to accomplish. Can you tell us a little bit about what they are and how they work?
Sure. So within our practice, we do a lot of breast reconstruction and help women navigate that process. And as someone who did a microsurgery fellowship, a lot of women come to me specifically for looking at options to reconstruct the breast without implants. Now, certainly I do a lot of implant-based reconstruction, but I would say that given my special training, I do a lot of autologous reconstruction using women's own tissue to reconstruct the breast. And within that field specifically, there's been a lot of new and exciting interest in helping to provide sensation to the tissue that we bring in for the breast reconstruction. And that's been very exciting and rewarding for us and our patients. From a cosmetic perspective, we see a lot of patients who are interested in facial and body rejuvenation, both surgical and non-surgical. So certainly we offer things surgically, mommy makeovers, breast augmentations, tummy tucks, but beyond that, we also have non-surgical options to address reducing fat deposition in certain areas, increasing skin tone, and preventing laxity. And of course, we have a very rich array of skincare options here. So whether or not you're interested in microneedling or radio frequency, we have enough tools to address pretty much the gamut of options.
So you pretty much offer everything under one roof, which is really beneficial to the patients. They don't have to go to a separate practice for the surgical option, another practice for the non-invasive. You do it all here in your practice.
Absolutely. And it's a funny thing because our patients that even come here don't necessarily notice that. So I had a patient yesterday who came in for a post-operative visit after a breast lift and liposuction. And she's like, "Oh, I didn't realize you did Botox." I'm like, "Of course we do Botox." So it's important for us to be able to convey that to our patients and for patients to ask what we have.
That's a true partnership with the patient to really understand their needs and exceed their expectations.
Well, we hope to here.
All right. And how are some of these procedures performed? Are they done right here at your practice?
So within our practice, we actually have 2 locations. So we're in Chevy Chase, Maryland, and then also in Annandale, Virginia. So within our Annandale office, we have an operating room. And that operating suite is a very private, beautiful suite that we have an anesthesiologist who administers anesthesia for us for our surgical procedures. But both of our offices do have minor room procedures as well as lasers and cool sculpting and some non-invasive options. So we can perform a lot of those surgeries in our offices, and very often we go to surgical centers as well.
Oh, that's great. Let's touch on body contouring. There are so many different ways, but whether it's liposuction or it's cool sculpting, what are some of the treatments that are the most effective procedures currently that you offer at the practice?
That's a great question, and one that I get certainly weekly, if not daily. And the reality is, it's important to talk to someone who can offer you both, because there are nuances when I examine a patient that I say, look, can you get a result with this or this option? Yes, but I feel as a medical provider that you are best served with, whether it's liposuction or cool sculpting, because everything has a place and will work in the optimal situation. But there's not a one size fits all when it comes to these things. And not everyone is a good candidate for cool sculpting, nor is everyone a good candidate for liposuction. So the way to think of it, even before coming to see us, is whether or not you have excess skin or just excess fat. And that can be a first step in kind of determining which might be a better option for you. But again, we're doing all of this with the patient's safety in mind. And so it's so important for you to talk to a medical provider, particularly one who's a board certified medical provider that can offer you both surgical and non-surgical.
And would you say it's the same with facial rejuvenation, whether it's a facelift that's surgical or the non-invasive options as well?
It is, because there's a lot of terms out there that people say, I want a lifestyle lift, or there's a lot of terms that people come in saying that they want. But the difference with facial rejuvenation is that I think there's an age element where younger patients are coming in saying that they are less interested in surgical options. And as patients age, I think they see the benefits long-term of surgery. But that's not across the board. There's a lot of patients who are only interested in one or the other. The bottom line is, whatever you think you're interested in coming into the office, it's my job and our job of the providers here at the Center for Plastic Surgery to educate you on the pros and cons of each and which one would best fit your goals.
Well, you're definitely doing some great work for patients. We actually interviewed some of them and heard some of the wonderful stories about their experience with you in the practice. What would you say are the types of results your patients are seeing overall?
Our patients are happy, which is great. I mean, this practice has been established for decades. I joined this practice 4 years ago, and during my time here, I've seen how we continue to grow. We continue to offer a very high quality product and keeping our patients safe and happy. So it's wonderful to see our patients transfer from skincare to surgical, back to skincare, from surgical over to the non-invasive stuff. It's very fluid. And so I think that speaks to the type of results our patients are getting. They're happy and they stay. We're a family here.
Well, that's so important, and to have them feel really comfortable. A lot of patients get nervous. They don't know what to expect when they go out and want to get body contouring or facial rejuvenation. So the fact that you sit down with each patient, take the time with them, make them feel really comfortable, says a lot about you and your practice.
Well, it's a critical aspect of it. We offer, high quality plastic surgery here, but first and foremost, of course, we're physicians, and that we take that very seriously. And so to have that relationship with our patients is everything to us.
Well, like I said, that says a lot. You guys are definitely doing great work in the community. So, Dr. Albino, who's a good candidate? I know there are a lot of different procedures, and you can use them in combination or based on each patient, but who would you say is a good candidate?
Well, in a very broad sense, I think a motivated patient is a perfect candidate, because no matter what surgery we're talking about, you want to have the patient as invested in their outcome and their recovery as you are as their physician. So when I look at my patients who are interested in mommy makeovers, for example, a combination of breast rejuvenation and abdominal contouring, sometimes with liposuction, sometimes with lifts, sometimes with implants, sometimes with all. Very often those patients said, I've thought about this for a long time, but the timing wasn't right. But now I'm in a position where I have the support at home, I have the time from work, and I'm motivated to get better. And I feel that's an ideal candidate for surgery. When they've thought about it for a while, they've researched it, maybe we've had a couple different consultations, and they know that now is the perfect time for them to have surgery.
You offer treatments that offer a natural result, which is really important because people don't really want to look like they had something done. And you guys do great work with that, not only combining the non-invasive procedures and techniques with the surgical if necessary, and the results are great. We're going to take a look at some of the patient testimonials at Dr. Albino's practice and hear about what their experience has been like, and we'll be right back.
I was really in the market for non-surgical facial rejuvenation, mostly chemical peels, fillers, and Botox. Every time I've been to the office, my experience has been great. The staff is very personable, and Dr. Albino just makes you feel like you're at home and you're always welcome. So I've always had a great time with all the procedures that I've had done. I've always been very happy with the results. It's been pretty important to me to stay or keep a more natural appearance. So he's always been very good at making everything very subtle, but I've always had the best results. Probably just the personable feeling you get when you're here, and then you are there's always availability to be seen. I've never had an issue getting in any time, but really it just feels like a very comfortable place to come and have anything done. I would highly recommend Dr. Albino to anyone who's looking for any sort of cosmetic procedure.
I came to Dr. Albino to get a breast reduction. Well, I was very nervous about the whole process of having surgery, but Dr. Albino and the staff, they were very calming. They explained the whole process to me and made me feel very comfortable with moving forward with the procedure. I absolutely loved the results. It was actually very life-changing. I didn't really understand how much of a hindrance the oversized breasts were until after I had the procedure, so I'm very happy. I would recommend Dr. Albino because he was very understanding. He was willing to explain everything. He made me feel extremely comfortable. The office and staff were equally as nice and friendly and welcoming, and they made the process very easy.
I was diagnosed with breast cancer 3 years ago, and my breast surgeon recommended Dr. Albino to me as an expert in deep flap reconstruction, which I was curious to hear more about. And so I first met Dr. Albino for my initial appointment to explain all of the options to me and what I could have done. So after Dr. Albino walked me through all of the different options, we did indeed decide on a deep flap reconstruction. And so after my cancer treatment, went through chemo and a bilateral mastectomy, Dr. Albino worked with me on a surgery plan, and we did the deep flap reconstruction later that year. I couldn't be happier. You know, the entire process was emotionally trying, physically trying, and through it all, Dr. Albino and all of his staff were incredibly professional, made me feel comfortable and secure. We still have a great relationship to this day, and all of my follow-ups and any of my other needs I have, I always come back to him, and it's been a wonderful process from start to finish. I would say that his very friendly and honest approach in each of his consultations, regardless of what you're thinking or what you know or don't know, will guide you to the right decision. His intuitive knowledge and his listening to each and every concern that you have really helps you make the best decision for yourself, whether it's a very personal one. Well, they're all very personal, right? In any plastic surgery. But he really guides you in a very friendly way, and I appreciated that, especially in my circumstance.
We're back with Dr. Albino. The patients really love you, whether it's breast reconstructive surgery, cosmetic treatments or procedures. You're doing great work. The patients are really happy with not only the results, but with the time that you take with them, the care that you give to them.
Well, it's such an important part of the process and the relationship we have with our patients. It allows us to most specifically tailor their treatment options and just help them along their journey, whatever that might be.
Well, that's wonderful. It's been a pleasure having you on the program today, Dr. Albino. You and your practice are recognized as top plastic surgeons throughout the region. You're doing great work. You're not only delivering wonderful results, but you really care about your patients. Can you tell us a little bit about what your approach is that sets you apart from other practices?
Absolutely. Well, as someone who's a healthcare provider but has been a patient myself, I think it's really critical to sit down with someone and understand where they're coming from and what their goals are. And very often that's one of my first questions. Not what are your surgical goals, but what do you want your results to look like at 1 year, at 10 years? How do you want this to impact your life? And really understanding where patients are coming from allows me to, I think, give a superior product and engage with them in a way that we have a connection.
Well, that's very informative. You're doing great work. Keep it up. And we'd love to have you back on the program in the future. Thank you so much for being a guest today.
Absolutely. It's my pleasure.
All right.
Thank you.
Wonderful.